is that, estrogen causes cancer, but in that group of women, it actually had a decreased risk of breast cancer, it was decreased risk of colon cancer. There still is evidence that estrogen decreases the risk of colorectal cancer, decreases the risk of Alzheimer's. And we know that your risk for heart disease goes up. If you just look at the graph of when women get heart disease and bone loss, it correlates exactly with our estrogen levels. So estrogen is actually cardioprotective. It's not cardioprotective in a 70-year-old woman who has never been exposed to estrogen. That's not when you would start it. But when you start something like this in the perimenopausal period, then there definitely are some things that will be protective. And so I know in a lot of communities, estrogen, again, there's just a lot of fear around it. There's just a lot of misunderstanding. And I understand why. I mean, I felt that way. That's how I was trained. That's why if you go to a provider, they're going to say, oh no, they could say that if they haven't been informed. And again, a lot of people just haven't gone back and looked at, okay, the study that really informed us to practice this way has been really debunked now. We don't think of it. So we're still working on how to re-educate providers to understand that. There's another resource, the Society for Women's Health Research. They have a really nice little pamphlet. It's called the Menopause Toolkit. And I actually helped work on creating this toolkit. It's for providers and for patients. But at the end of the day, this is a nonprofit organization, and they have a panel of professionals on there that are Harvard emeritus, researchers from all over the country. Like, again, I was invited to be on this panel, and I felt a lot of imposter syndrome there, because these people I felt like really knew and researched this. And they're the ones that were saying, we need to educate doctors and patients on how estrogen really works. So it really wasn't until about a year and a half ago that I felt 100% confident saying that statement. I had been hearing it at my functional medicine conferences, in my integrative medicine conferences, but I was still like, I'm not fringe. Like, I really am still a conventional medical doctor. That's how I've been trained. And I don't want to do anything to mislead people or, just be fringe or out there. But there really is a movement now that's in the process of trying to re-educate providers in particular so that they can educate patients. So the long answer to that is estrogen is safe. There are definitely some people that it's not best. The safest way to get your estrogen is transdermally, so an estrogen patch. Mm-hmm. If you go anywhere and somebody tells you you need to have a pellet, and they don't talk to you about any other type of ways to get your estrogen, I would go the other way. Pellets are not terrible, but they're not for everybody. And that's definitely not where I would start with your understanding of hormone replacement. And let me explain. A pellet is a little pill that we make a little incision in the skin, and then we take like a little trocar like this, and we create a little hole, so to speak, and we put the pellet in. It actually goes in your backside. We put the pellet in, and then it lasts for about 3 months. It's a great way sometimes to get testosterone, but it's kind of controversial. It's not widely accepted by the American College of OB-GYNs or even the Northern American Menopause Society. But transdermal estrogen patch is the simplest and easiest way you can get your estrogen. Orally, estrogen has to go through the liver, so we call that the first pass effect, and it can have other impacts on your clotting factors, so you could have increased risk for blood clots. And so you want to get your estrogen as safely as you can, and that would typically be a transdermally. But if you have to take it orally, the risk isn't, I wouldn't say it's hugely significant, but if you have a history of blood clots and things, your doctor's probably not going to put you on estrogen anyway. And it's a hard area to navigate. If you have a family history of breast cancer, it is still safe, because just because somebody in your family had it doesn't mean that you're going to have breast cancer. You really need to assess what your actual breast cancer risk is. And then that's a personal decision. I have a lot of patients, their mom had breast cancer, their grandmother, and they don't want to. If you have a personal history of breast cancer, the average provider is not going to put you on estrogen, although that's in some circles, that's controversial as well. So I know I probably didn't answer the question because it gets controversial, but
No,
overall.
You've reached it. You've talked about it. It's just that women have to go through so much. Just listening to this conversation, there's so much to consider.
It is a lot, especially on that topic. I feel bad. I feel bad for lay people because I barely feel comfortable and understand it. If I'm honest, I'm like, okay, are we okay? I mean, because I'm telling other people, so I want to make sure I'm giving you, good information. So all I can tell you is my kind of aha moment, my moment where I felt like, okay, what I've been doing for the last 8 years is okay. But, I was a little sometimes like, I'm not sure. Mm-hmm. And that's just the sad. I mean, the research in women's health is just, we're so behind. Yeah. Yes. And it's just, it's just starting to scratch the surface. The NIH just created a category for menopause, I think a couple of years ago. It's ridiculous. Yeah. It's really ridiculous. There's a book called The Sweetness of Venus, A History of the Clitoris.
Nadine had to send me the
Sarah
link.
Chadwick.
Can you say that again? The sweetness of what?
It's called The Sweetness of Venus, A History of the Clitoris.
Okay.
And she really talks about, it's not so much about menopause, and I haven't even finished the whole book. I read probably almost half of it, but it really does help you understand how in medicine, some things they just literally made up about women, especially about our genitalia and understanding our sexual response. It goes back as far as Hippocrates. They literally just made up stuff. And then up until I think the clitoris was just imaged for the first time through MRI in 2002. It's crazy if you hear how behind we are. It's literally in the 2000s that certain things are just being discovered. Medical school anatomy books didn't even have the clitoris in them. They're just starting to show real female anatomy in the books, and they don't even have the clitoris, the full mapping of it. It's mind blowing. But if you read that book, you'll really begin to understand how we've been really just been given we've really almost been fed a lie about a lot of things. And there wasn't this understanding. We were told and taught things that you kind of took as fact, but you didn't, but you're like, well, where did that come from? And then you go back and you realize that came back from, 2000 AD, and they literally made that up. So it wasn't even based on anything. It's impressive.
So I know women who are taking all kinds of supplements for everything. So can you talk to us, you talk about this in your book, about hormone balancing supplements and botanicals and other treatments, and what's the best way to begin to have this kind of discussion with your doctor, nurse practitioner, midwife, et cetera?
Yeah, well, I'm going to tell you that you really, in my opinion, one of the better people to talk to about any type of supplements around menopause is probably not going to be a provider. Maybe a nurse practitioner if they're really informed, and maybe a few doctors, but even doctors who are informed in menopause are generally not informed in the supplement area. So a naturopath, a really good naturopath. And I know it sounds crazy. We got to go to the naturopath. We got to go to the nurse practitioner. We got to go do our research. We got to do all these things. But unfortunately, if you want to get the best information, I think naturopaths in that area are are superior to anybody because they really understand. Or functional medicine doctors, like that's why I like functional medicine docs and integrative medical docs, because they understand the use of supplements. And I didn't mention that when I was talking about the difference between them, but that's where we will incorporate traditional Chinese medicine. So like, for example, acupuncture can be wonderful way and really almost first line for really dealing with some of the symptoms. And the supplements, I mean, that is such a tricky terrain. But at the end of the day, one of the most common supplements I recommend for women, especially in the perimenopausal period, is chaste tree or Vitex, because it helps to balance out your progesterone. And I mentioned that earlier, like